It is the Gee and Ursula Show. Coming up in 15 minutes, we'll do scenarios. Someone writes in and says their husband is a cheapskate. How dare she? But right now, we're hearing about people being infected with COVID after getting the vaccine. So let's bring in Dr. Angela Rasmussen right now. Hello, my good friend.
Hello, Gee. How you doing today?
I'm good. I just want to let you know we have Aaron Mason is going to be filling in for Ursula, so you'll be hearing a different voice outside of Ursula. But I want to get right into it, Doctor. We're hearing about some workers at Samaritan Healthcare out there in Moses Lake who have tested positive after getting both vaccine shots. Is there any data showing people can get infected still?
Well, there have been some cases reported of people becoming infected after being vaccinated. In some cases, this is, they're still in the period where their vaccine is really ramping up, so you don't really have full protection until about 1 to 2 weeks after your second shot. But that said, no vaccine is 100% effective at preventing infection. And these vaccines are very effective at preventing disease, but we actually don't know how good they are at preventing infection altogether. So it's not unexpected that people who have been vaccinated will end up testing positive. Hopefully those cases in Moses Lake that you're referring to won't be associated with severe disease. They won't get very sick from COVID-19. So the vaccines are still incredibly beneficial, even if they're not 100%.
Doctor, we're looking at King County right now. I'm taking a look here, and COVID cases are up 31%. We're opening up more. Are you worried about this? Should we be concerned? I know we're down from our peaks, but it looks like it's turning back up again.
Yeah, I think we should be very worried about this. We should be very mindful that just because we have vaccines, those vaccines alone are not going to get us out of this. We also need to be getting transmission down as we get immunizations up. And right now, we've certainly improved the rate at which we are delivering vaccines to people, but we're nowhere near the herd immunity threshold. And we have these variants circulating throughout the country, including in Washington state, that are more transmissible. So we really do need to buckle down in our efforts to also reduce our own exposure risk, masking, distancing, avoiding enclosed spaces and crowds, et cetera, while we continue to vaccinate people. I think that countrywide, not just in King County, not just in Washington state, a lot of places have really been opening up prematurely. I think if we could have hung in there a little bit longer, we wouldn't necessarily be in the situation that we're in today.
I got a question from the 425, Doctor. What is the likelihood of someone who is vaccinated infecting someone who hasn't been vaccinated?
So that's an excellent question, and we don't actually know, unfortunately. There have not really been reports of transmission from vaccinated people to unvaccinated people. But that said, we are not able to investigate every new case of COVID and find out where it came from. So right now, where we're at is kind of erring on the side of caution, assuming that vaccinated people probably are less likely to spread the virus if they do become infected. But saying that we don't know for sure. So that's why CDC, for example, has recommended that in public spaces, even vaccinated people should continue to wear masks and take precautions.
So we are in phase 3 in Washington, and that allowed. They're saying you can have up to 10 people in your house or 50 outside if you want to have like a barbecue or something. How do you feel about that?
So I feel less good about the indoor gatherings. I think that even having a few people, if they're not from your own household, gathering at length indoors without masks, without distancing is a generally bad idea. I think that is what drove a lot of the transmission over the holidays, are smaller indoor gatherings like that. Outdoor gatherings are a little bit different. We know that the risk of transmission outdoors is considerably lower. Now, that said, it's not impossible to contract the virus outdoors. People should still be mindful of distancing and other precautionary measures meant to reduce transmission when they're in outdoor environments. But generally, I think that it probably is okay to have outdoor gatherings, provided that they're not huge and super crowded.
All right, Doctor. Let's go back to, I want to keep it here local here, King County. King County Public Health right now has identified these Brazilian variants. And we are trying to kind of understand the variants, as you know, we're trying to learn about this. And then, of course, the regular COVID, we're trying to get transmission rates down. Help us understand, what's the worst case scenario when it comes to these variants? And what's the best case scenario? Help us understand that.
So the worst case scenario, specifically with the P1 variant that was discovered in Brazil that you just mentioned, is that variant it has some mutations in it that are less effectively neutralized by antibodies produced by the vaccine. So the worst case scenario is that even when we have a larger number of people vaccinated, that variant will continue to spread and potentially acquire more mutations that make it even more resistant to vaccines, maybe will make it more virulent or more transmissible. The best case scenario, though, and this is what I really like to remind people of with these variants, is that the vaccines still work at preventing disease, even though they might not prevent infection. And all of the data so far that shows that the variants are a bit more resistant to immunity from vaccines, it does not show that those variants are associated with more hospitalizations, more deaths. So that's good news. That's cautiously optimistic news that vaccines will still work against the variants for the things we need them to work on most, and that is preventing severe disease. Now, I should add here that variants emerge when the virus is given a lot of opportunities to replicate. Mutation is something that normally happens with viruses every time they copy their genome, and sometimes those mutations, through luck for the virus, can give the virus some sort of advantage. So one way to prevent other variants from emerging is to continue to take precautions meant to reduce transmission, because less transmission means less opportunities for the virus to replicate and acquire mutations, means fewer variants.
Well, Dr. Rasmussen, every Tuesday, we really appreciate your time. Of course, we got about another hour of questions that we wish we can ask, but I guess we'll have to wait until next week. Enjoy the rest of your day, and tell Taz hello.
Always, Gee. Take care.
All right. That is Dr. Ursula Rasmussen. And